Welcome to another conversation on religion and mental illness. I'm Dr. Nancy Keogh, a clinical psychologist and author of the book Wrestling with Our Inner Angels, Faith, Mental Illness, and the Journey to Wholeness. I'm speaking today with Dr. Othman Mohammad, a child psychiatry fellow at Children's Hospital. Dr. Mohammad, thank you so much for joining us.
Thank you.
You've done a great deal of work on Islam and mental illness. What would you say you have learned in the process of the interface between that tradition and mental illness?
I think the first lesson that I learned was that Islam is not dismissive of mental illness, and that there are multiple narrations in tradition that talk about how to take care of one's mental health. The Prophet of Islam himself, in his supplications and prayers, many times would talk about asking God to save him from the burden of depression and anxiety and oppression. And even with families who suffered from grief, he would send them comfort foods to help them relax and calm down. So the general principle is that there was no dismission of the mental illness and the mental health need.
So he was very psychologically minded.
It seems to be from the narrations that we have about him and about how he worked with his followers, and how he was attuned to their psychological needs and how they perceived the world. And he, in multiple times, actually tailored specific psychological interventions for them that were specific to these people. For example, a man came to him and he said, "Give me an advice," and he would say, "Don't get angry." And he would say it twice and thrice because apparently he knew that that man was very angry. A different man would come and say, "Give me an advice," and he would say, "Take care of your parents, especially your mom," because he knew that probably that man was not that great of a child to the parents. So in that sense, yes, he was psychologically minded.
What would you say is the understanding of the difference between a spiritual crisis and a mental illness?
From an Islamic framework, I think that there is a link at one level when we're not talking about serious mental illness. There are very biological disorders that seem to be underpinned in genetics and biology, but stress can actually also induce an earlier onset for these disorders. But when we talk about anxiety and depression, which are the ailments of the modern world, Islam does have to say about that. And Islam's hypothesis and theory is that an estrangement from the divine, being alienated from God, and not feeling connected in some way to the world within this faith tradition, could actually lead to a crisis. Of course, this is not a general theme for everyone. But that could be one framework of thinking about how somebody might be struggling with their mental health. This is especially important for somebody who was born in a faith and practiced that faith for a while, and they perceived themselves as part of that faith group, and for some reason felt estranged away from that practice, leading to possibly a psychological stressor. This is what actually is also in DSM-4. In the back of the book, now it's a DSM-5 era, but back in the days in DSM-4, it used actually to be diagnosed as a religious problem.
So in concluding our conversation, what one message would you like to leave our viewers with if they're working with a person from the Muslim tradition, but they are not of that tradition themselves?
I think what would be a good thing to do is what most good clinicians do, is to ask the patients very humbly, teach them about themselves, about their families, about their faith, and to take a very careful history about what matters for this family. Because not all Muslim families come from the same background. There are subcultures in different Muslim families, so important to know about that family. If that is important for the family, if Islam is one of their pillars that they use in their lives, to implore and to use techniques that Islam uses, such as reliance on God and submission to God and being content with what one has, and endurance and perseverance and patience. These are primary psychological concepts that Islam uses to help people cope with anxiety and stress of this life.
Great. Well, thank you so much, Dr. Mohammad, for joining us in this conversation.
Pleasure to be here. Thank you.